Okay, so we all refer to this as Lawsonia, but the actual disease itself is equine proliferative enteropathy, which is EPE. And a lot of you who have had foals that have been affected with this, unfortunately, have great experience with it. But for those of you who don't, I'm just going to give a really brief background on what the disease is and sort of what it entails. Lawsonia intracellularis is actually the causative agent of this proliferative enteropathy, and it's a bacteria that they get in their GI tract. It's a disease of young horses, that's for sure, 4 to 7 months, but quite honestly, we've been finding it in older foals and even up to 2 years of age. And we think that the stress of weaning and, at the same time as their maternal antibodies are wearing off, is kind of why this age group is the most susceptible. And the months when these foals are, 4 to 7 months of age is August to January, and that's when we most commonly see this, but can be later than that as well. All these foals in these slides actually have had Lawsonia. This one was definitely affected. So what this does is it causes a thickening of the small intestine. It causes malabsorption and protein loss. And so the loss of protein, specifically albumin, it causes peripheral edema in their throat latch, which is the classic, bottlenecked foals that you see with Lawsonia. And in their legs and sometimes their abdomen as well. And these foals can be febrile, but not necessarily. They get lethargic. Most of them will get depressed, and it's the big inappetence that leads to this profound loss, weight loss. And this can be a very, very, very devastating disease as far as trying to get these foals to the sale. And we will lose some of these foals as well because it affects them so profoundly. Your blood work kind of tells you what's going on, but even before you get blood work, if you scan these abdomens, you get your classic, we call them Lawsonia donuts, but this is the small intestine, and this is the wall thickness, and this is over 1 centimeter, and this was one of my actual cases here. And so that's you can imagine that there's nothing being absorbed there, that's for sure. So and if you really want to diagnose it, you can do a fecal PCR and blood titer, but usually we don't need those things to diagnose. So treatment, you get, it is a bacteria, so we use antimicrobials. LA200 you'll see us use, usually for the first 5 days at least, and then sometimes we switch to doxycycline. Some of these more sinister cases will need chloramphenicol. We do gastric protectants and anti-inflammatories. But the more severe cases, some of these guys will need plasma and head-a-start. And so this is a weanling that actually was diagnosed with EPE or Lawsonia, and so they need this to bring up their oncotic pressure and kind of replace some of those protein-bound coagulation factors and things like that. And they just feel better after they get the plasma as well. So, does a vaccine exist to prevent this? I sadly have dealt with this disease probably more than most, and so if there was a chance that maybe something might work to prevent this, we wanted to try it. So this guy actually did have Lawsonia for whatever reason. He's awful cute, but this foal was pretty miserable. He developed edema in his muzzle, but he went on to do fine. So the vaccine is a live Lawsonia intracellularis vaccine. It is actually labeled for pigs, which is a little bit frightening, but you give it intrarectally twice, 30 days apart. And this is definitely used off-label in horses. But we just decided we needed to try something, So August, September, October is when we usually like to give them. And previous studies that have done with this demonstrated that they are safe, but we just never had a good kind of environmental challenge because the years that it was tried in experimentally here in central Kentucky, they just didn't have a big challenge. So at any rate, It's really, really easy. We use these small, flexible catheters, and if your foals are used to getting their temperature taken, they protest very little. It takes less than 5 minutes a foal, and there are minimal to no side effects reported. You just have to be careful, like you would anytime you're taking a temperature, not to kind of disrupt that rectal mucosa there. But really, we've done really well. So in my experience, this is extremely subjective. So don't criticize my scientific method because there was none. We just decided, hey, we need to try this and see if it works because we know it's safe. Let's just see if we think that, that this is going to work for us. So in 2017, 2018, our practice vaccinated almost 150 foals. Most of those were by me. We did, most of them were 2-dose series, but for whatever reason, a few of them were just 1 dose. And all the farms that we tried this on were considered endemic for EPE. Like, we've lost foals on all these farms in previous years, and they get cases of Lawsonia literally every single year. And just to address the environmental challenge, in 2017 was definitely a pretty profound year for Lawsonia cases, especially in some of those endemic farms that did not do the vaccine, and so we felt like it was an adequate challenge last year. And so this is the key here. No foals on any of our vaccinated farms developed Lawsonia. So it was pretty, like I said, there's nothing scientific about the study. We just said, let's just see if this is going to work, and none of our vaccinated foals got the disease this year. So we thought that was pretty good. So my overall impression, the vaccine is definitely safe. And I would, without hesitation, recommend this to any endemic farms. The non-endemic farms are sort of going to have to weigh the cost with the, cost effectiveness anyway. It's a little bit over $70 a dose, and you do it twice. So, if you have 150 foals and you only get 1 with Lawsonia every year, maybe it's not worth it for you, but these endemic farms, it's definitely a good idea, that's for sure. And all the farms that I have used it on this year have been extremely satisfied. So it's just something else to sort of have in your tool shed to fight this disease, because if you do get a foal that gets it, it's pretty significantly devastating, that's for sure. So, and I think that is it for that.